Hi, today I will be talking about motivational interviewing and its use in the context of exercise and sports. So, before we can talk about it in this particular context, first you need to understand what motivational interviewing is. So, motivational interviewing is a counseling technique that changes a process and accepts negative behaviors in order to change them for the better. So this can be used in the context of substance abuse or weight loss, exercise, as we're talking about today. So it's not just any old counseling technique. It's something special, and it uses humanistic ideologies and optimism. It relies on self-actualization and how taking the first steps for acceptance can lead through to making big life changes and being able to become better for yourself by getting rid of these negative behaviors and ideas such as substance abuse or lack of exercise, bad diet, whatever it may be. So there are many stages within this process and journey through using motivational interviewing in order to better oneself. There are many stages, right? There's 5 main ones. The first one being pre-contemplation. In that stage, the individual is not quite ready to accept the change. There's doubt and increased perception of the risk and an acknowledgement of the problem. However, they're still not ready to take this action. The second stage is contemplation. In this stage, it is the phase where the client is getting ready to take these changes. This is a stage where people often weigh out the pros and the cons and explore alternatives and ideas and able to make these changes and see what the risks are if they don't change. Then the third stage is preparation and action. This is where the client or the person is just ready to take the change. In this stage, as a medical professional, it's our job to help set the goals, but we aren't the ones that make them. That's on the role of the client. They set out their goals and we help them set them and make them achievable. And then the next stage is maintenance, and that's just having to stick to it and ensuring that a relapse doesn't happen. And that being said, there isn't anything wrong with a relapse. That's the 5th stage. If a relapse does happen, that's where we take the initiative, and both the client and yourself as the professional can learn from these experiences and how to better on for future attempts. Because, learning from the past is how we can better ourselves. And especially in this context, when you learn from what didn't work, you can alter the plan so that it does work. Okay, and so in this context, it is taking a person who knows maybe they are overweight, aren't exercising anywhere enough, a 9-to-5 desk job where you can't or don't have as much opportunity to take that step and be more active in your life, because time's hard and life happens. So with that being said, there are ways in order to change that, be it taking half an hour out of your day to go take a walk, or to go and take the dog for a walk, or go outside and play with the kids if you have them, and making these time, and it doesn't have to be much in order to change it. And that's the best part, is that it doesn't take a lot of time. It's the small things, the small changes lead up to being able to achieve the overall overarching goal. And that's how motivational interviewing, that's where it steps in, So being able to take these techniques, as mentioned earlier, and put them into practice so that we can achieve these exercise goals is truly the main goal. And with that being said, that's all I have to say. So thank you. And motivational interviewing, keep it in mind. Exercise, keep it in mind. It's all beneficial.